Hello, I'm Judith, the Chief Executive of Aneurin Bevan University Health Board. Yesterday we had a meeting of our board in public session, and I thought it would be helpful to give you an update on some of the issues that we discussed. We started the meeting with a patient story in relation to older adult mental health services, a very moving story about one of our members of our community who'd been diagnosed at an early age with early onset dementia. And her partner and the staff who'd been caring for her talked about her care journey from diagnosis through to residential care. This was supplemented then by a presentation from our older adult mental health service on some of the changes that the Health Board has made to older adult mental health services over the last year, following a decision to reconfigure those services to move resources from some of our inpatient settings to more community-based resources. And we had a positive discussion about how the additional £600,000 investment that the Health Board had made in community support for people with dementia and mental health issues in older age had been addressed, and the progress that we were making in terms of that service redesign. Following the patient story, the board moved in to consider some of its assurance issues. So we had a update from the Director of Finance on the financial position of the Health Board, and confirmation that the Health Board was still on track to achieve financial balance as we move towards the end of the financial year, with some risks still to be managed, including costs associated with managing over the winter months, but generally assurance that plans were in place to achieve our statutory duty. There was also an update on performance issues across the Health Board, recognising the requirements to achieve certain improvements that the Health Board committed to as part of its current IMTP, and a useful discussion at the board across the range of those objectives where the Health Board was working to improve on its performance in the previous year. Just one example that was given when we looked at our performance in December 2018 was the comparison of the number of patients who were waiting beyond 36 weeks for treatment following their referral to the Health Board. In December 2018, that number was 249. And when we go back to December 2015, that number was 4,158 people. So the Health Board was assured that in many areas it was meeting its commitment to improve access and improve on its performance, making sure that patients were put first at all times. There was also an update on our risk report and some other assurance matters that needed to be dealt with by the board at the meeting yesterday. There were also some more significant strategic issues that the board addressed yesterday at the meeting. The board approved its integrated medium-term plan for the next 3 years, which is required to go to Welsh Government at the end of this month. It also approved its estate strategy. Work on the estate strategy for the Health Board has been underway for the last 6 to 9 months, and it was good to bring that to fruition with a board discussion yesterday and approval from the board of that strategy. The board also had an update on nurse staffing levels in relation to the Nurse Staffing Act, approved a business case for a new laboratory information system at outline business case stage. That will now go to full business case. Had an update on the clinical future strategy and the progress on the building of the Grange University Hospital, and also then had a paper on the launch of 111, which is due to come to the Aneurin Bevan Health Board area in April as part of the national rollout programme for 111 under the auspices of the National Programme Board. So we also managed to squeeze in an update from the Director of Operations at the meeting yesterday on how the Health Board was coping with the challenges of winter. December was a particularly pressurised month for us, but January is improving in terms of the way in which we're coping with that demand. We have continued to see an increase in the number of very ill MAGES patients arriving in our emergency department, and the staff and team are coping really well to ensure that we address the quality and patient safety issues in terms of that demand, with 2-hourly patient safety huddles and a real focus on making sure we're keeping patients safe. All of the board wanted to acknowledge how well and how hard the staff are working, The plan that the Health Board put in place with its partners seems to be holding well. The investment that we've received from Welsh Government and the investment that the board has made in winter is holding us in good stead. And we have also been really busy with a communications campaign, supporting staff through our Winter Heroes initiative, which has been really appreciated by staff, but also an external campaign encouraging our communities to choose well and making sure that our communities know and our patients know that we'll continue to put them first over winter. The next board meeting is in March. If you want to see any of the papers from the January board meeting, they are on our website. And if you want to follow up anything from the papers or anything from this short video, please get in contact with us in the normal way and we'll answer any queries you've got. Many thanks for now. Diolch yn fawr.